The information in this video is based on up-to-date evidence and expert opinion at the time of its recording. It is intended to complement, not to replace, appropriate training and national and local guidelines. We hope you enjoy the St John's Derm Academy Dermatology educational video on how to inject local anaesthetic intended for healthcare professionals. Before starting, confirm patient identity and consent. Prepare your equipment on a sterile field. Ensure that you are using the correct concentration of anaesthetic and that it is in date. Ask the patient if they have allergies. Draw up the anaesthetic into a syringe, expel air bubbles and ensure the needle is secure. If appropriate, mark the intended injection site using a surgical marker. Cleanse the skin with appropriate antiseptic, allowing it to dry to reduce stinging on injection. Hold the syringe in your dominant hand and gently stretch the skin with your non-dominant hand. Insert the needle bevel up at an angle of approximately 30 degrees for intradermal injections, or 45 to 90 degrees for subcutaneous injections. Briefly aspirate to check for blood return before injecting. This ensures that you are not directly injecting local anaesthetic intravenously. Once the anaesthetic is administered, withdraw the needle and apply gentle pressure with gauze. Dispose of the needle and syringe safely into the sharps bin. Check the area for blanching or numbness before starting your procedure. 3 tips to minimise discomfort. 1. You should carefully and quickly insert the needle into the dermis. Slowly inserting the needle is painful for most patients. 2. You should inject the local anaesthetic at a slow and constant rate. In general, the slower you inject the local anaesthetic, the more comfortable it would be for your patient. And 3. Distracting the patient with small talk is helpful for most patients. Thank you for watching. For more videos on dermatological procedures, including suturing and skin biopsies, please see the description box for links to our educational content.